So in today's medicine lesson, I'm going to talk about asthma, and my name is Kamwendo. So when it comes to asthma, I'll just give a brief introduction of what asthma is. So asthma is a chronic inflammatory disease of the airway, and this is caused by hyperresponsiveness of the airway. So the airway is mainly hyperresponsive even to minimal irritants, making it to react easily and initiating an inflammatory response. And when this happens, you're going to see the edema of the mucosa lining the airway, as well as mucus production because of the inflammatory process. So you find that this inflammation ultimately leads to recurrent episodes of asthma symptoms such as cough, chest tightness, wheezing, dyspnea, and you find that asthma can occur at any particular age, and it is the most common chronic disease of childhood. But you find that asthma mainly differs from other obstructive lung disease in that it is largely reversible, either spontaneously or with the treatment. And you find that allergy is the strongest predisposing factor for asthma, as well as sometimes chronic exposure to airway irritants or allergens. Also, they increase development of asthma in an individual, among others, among other predispositions such as genetic predisposition. So in terms of the brief background or introduction of asthma, that is basically how we can describe asthma. Now, how can we define asthma? So we can define asthma as this is a chronic inflammatory disorder of the respiratory tract in which there is hypersensitivity of the airway characterized by difficulties in breathing, wheezing, as well as chest pain. So in asthma, there is chronic inflammation. This inflammation is reversible. That's the good thing. But someone who continuously start experiencing inflammation of the air whenever they're exposed to a particular irritant. And in this particular case, this happens because the airway is hypersensitive, or it responds too easily as compared to someone who has uncompromised airway, where they may be exposed to dust, they may be exposed to pollen, they may be exposed to perfume, but they may not it may not result in inflammation. But in this particular case, in asthma, because of a hypersensitive airway, someone continuously goes into recurrent inflammatory effects of the airway because the airway is hypersensitive. And when this happens, you're going to see wheezing because of a constricted airway, as well as edema of the airway, reducing the lumen of the airway. As a result, you keep on hearing those wheezing, like there's a whistle ringing in someone's chest as they breathe. Apart from that, we talked of dyspnea, difficulties in breathing. This will be coupled together with edema of the airway, as well as congestion in the lungs, and chest tightness as well. Because of congestion in the lungs, someone feels like there's something compressing against their chest. When it comes to classification, asthma can be classified as either intrinsic or extrinsic. So in terms of extrinsic asthma, this is the type of asthma with a definite external cause, where you're able to identify a particular external cause or prolonged exposure to a particular irritant. And this one, it mostly occurs in atopic individuals who show positive skin prick reaction to common inhalant allergens. Apart from that, it starts in childhood, and it can also be caused by allergies like pollen, dust, animal dander, feather, food, among others. And patients usually have a history of asthma or allergies in the family, or when you look at past medical history, the patient may have, or in the family, they may have past medical history of asthma or allergic rhinitis. These are some of the common predisposition in terms of extrinsic asthma. Then in terms of intrinsic asthma, this occurs where there is no causative agent that can be identified, and it's non-allergic, and it occurs secondary to respiratory tract infection. It can even develop in adulthood with no history of asthma in the family at all. So in terms of the classification, that's how we can classify asthma. Okay, let us look at some common factors that may trigger someone to go into an asthmatic attack, meaning predisposing factors of an asthmatic attack. Remember, asthma what is going to cause a problem is when a patient goes into an asthmatic attack, but without an attack, they're actually okay. So what are some of the predisposing factors? When we talk of environmental factors, we can talk of change in temperature, especially when it is cold. And this is because when it is cold, the lumen of the airway reduces in size, as well as the brush borders of the airway become stiff, impairing their ability to expel foreign organisms. And this is how someone can easily go into an asthmatic attack, because of the physiological changes that occurs when the temperatures are low, when it's cold. Apart from that, when there's humidity, especially humidifying dry air, when it is very dry, this can also easily initiate an asthmatic attack. Apart from that, we have atmospheric pollutants such as cigarette, industrial fumes, sulfur dioxide. So you have such irritants that may easily cause someone to go into an asthmatic attack whenever they breathe in such irritants, and this may end up initiating an asthmatic attack. Apart from that, strong odor like strong perfumes. You find that just putting on strong perfume, this can also cause someone going to an asthmatic attack. Allergens like feather, animal dander, dust, mold, you have salad shellfish rather, you have fresh as well as dry fruits. These are some of the things that may cause someone to go into an asthmatic attack, because they are allergic to those things. That's why in terms of asthma, it is very cardinal to identify a particular predisposing factor and be able to manage it or prevent reoccurrence of asthmatic attack by identifying those particular things, especially in extrinsic asthma. Apart from that, exercises. So strenuous exercises may put pressure on the airway. You may find Okay, so you may find that these can easily cause stress on these particular individuals, resulting in an asthmatic attack. Okay. Okay, so apart from that, we have other predisposing factors, and amongst other predisposing factors, we have medications. So in terms of medications, we can talk of medications such as non-steroidal anti-inflammatory drugs, and commonly amongst the non-anti-inflammatory steroidal anti-inflammatory drugs, we have drugs such as aspirin. So aspirin can easily initiate an inflammation of the airway, resulting in asthma. Beta blockers as well, these are other drugs that can also initiate or cause an asthmatic attack. We also have chemicals such as paint, rubber, plastic. And these are also other chemicals that can easily cause an asthmatic attack. So in terms of predisposing factors of an asthmatic attack, these are some of the predisposition that an individual with asthma may want to avoid, so as not to go into an asthmatic attack. Okay, so we can look at the pathophysiology or the disease progression of an asthmatic attack. In this particular case, we are looking at the pathophysiology of how an individual goes into an asthmatic attack and what happens, not necessarily what happens for someone to develop asthma, because some of the causes of asthma in terms of intrinsic, where you have no particular cause and what you may just suspect is genetic predisposition. But in terms of extrinsic, whatever exposure is, then it may result into development of an asthmatic attack. So this is the perspective that we are going to look at. So in terms of the pathophysiology of asthma, we need to talk about the bronchoconstriction, what happens or what causes bronchoconstriction, what causes airway edema, as well as what happens when there is the airway remodeling, and then you see other symptoms coming in. So when it comes to the pathophysiology, we can say when a patient is exposed to a particular irritant, he or she is hypersensitive to, such as the smoke, pollen, or perfume. These allergens will interact with the immunoglobulin E on the mast cells. And this will cause degranulation of the mast cells in the bronchial wall, leading to rupture of the mast cells, which releases chemical mediators such as histamine, bradykinin, leukotrienes, and prostaglandin. These chemical mediators of inflammation will lead to bronchoconstriction, increased vascular permeability, and leakage, contributing to edema and mucus secretion. Furthermore, mucosal thickening and airway swelling will occur, thus the air will become more rigid and prevent a conduction of air to the lungs. Dyspnea will happen dyspnea will happen as well as wheezing due to mucus secretion and bronchospasm as well as bronchoconstriction. Furthermore, edema, due to edema of the airway, there will be persistence, especially in persistence asthma or chronic asthma, which is characterized by an influx of numerous inflammatory cells. You'll find that there is transformation as well as participation of the airway structural cells and the secretion of array of cytokines such as chemokines as well as growth factor. And these they worsen edema as well as inflammation, increasing also mucus hypersecretion and formation of mucus plugs. And because of formation of mucus plugs, this now causes further difficulties in breathing and also chest retraction. But apart from that, you'll find that, anyway, this is where our pathophysiology ends. But you'll find that in asthma, whenever a patient experiences an asthmatic attack, remodeling will take place and the patient will go into their normal state. So you find that there is a permanent structural changes that occur in the airway, and these are associated with progressive loss of lung function that is not prevented by or fully reversible by the therapy that is given. Hence, someone may now go into a permanent failure of the respiratory tract because healing has not successfully taken place, or because someone has continuously been experiencing recurrent asthmatic attacks. So in terms of pathophysiology of asthma, that is what you can talk about. Talk about bronchoconstriction to a point where someone is having difficulties in breathing because of this edema and other factors coming in. But remember that there's also remodeling that takes place, and this helps heal the inflamed respiratory tract so that someone can easily breathe. But remodeling may also fail to a point where someone now has recurrent failure of the respiratory tract because they have experienced too many asthmatic attacks, damaging the respiratory tract or the airway. In terms of clinical manifestations or clinical features, you'll find that some of the clinical features that may be seen in asthma, and when we say clinical features, we mean also signs and symptoms. So in terms of clinical features, we can talk of wheezing, and these wheezing respirations are due to airway blockage or presence of fluids in the airway. Apart from that, there is also forced or prolonged expiration due to bronchospasms, dry cough, and this dry cough is due to presence of fluids in the airway. Chest tightness due to bronchoconstriction. There is anxiety due to breathlessness. Apart from that, there is diaphoresis, which is due to labored breathing. There is dyspnea due to presence of thick mucus blocking the airway, coupled with bronchospasms and edema. Apart from that, there is orthopnea due to dyspnea, especially in the upright, when the patient is in the upright position. Apart from that, there is cyanosis due to reduced oxygen supply to the peripheral body tissue. There is hypoxia due to reduced oxygen supply circulating in the blood. Apart from that, there is hypercapnia due to increased carbon dioxide levels in the blood. So these are some of the signs and symptoms that may be seen in asthma, or as someone is having an asthmatic attack. So now, how can we manage asthma? As usual, when you are talking about management of any condition, you need to start with AIMS. And in this particular case, this condition requires drugs for you to successfully manage this particular patient. Therefore, our management will start from medical, then we talk about nursing management as well. So in terms of AIMS, you can talk about to promote a patent airway, to promote a quick recovery. You can talk about to resuscitate the patient, to prevent complications such as status asthmaticus. So these are some of the of the aims that you can talk about, including to relieve cardinal symptoms of asthma. So just 4 aims or objectives, then you are home and dry. Then in terms of medical management, as usual, you need to start with investigations, at least 5 investigations. And the first point on investigation should always be a history taking point. So here you can say the patient will present with history of asthma in the family or history of exposure to a particular allergen or irritant. Apart from that, you can do lung function test, and this will review a degree of obstruction or impairment of the lung. Apart from that, you can do a chest X-ray, which will show hyperinflation with areas of focal atelectasis. Apart from that, it will just show constricted airway. Then apart from that, you can do a skin sensitivity test, and the skin sensitivity test will identify a particular allergen or trigger. You can do arterial blood gas analysis, and this will review reduce the peripheral oxygen supply. The partial pressures of oxygen will be reduced, and the partial pressures of carbon dioxide will be raised. So at least 5 investigations, then you go to treatment. In terms of treatment, you can give aminophylline 250 milligrams slowly over 10 minutes, but you need to talk about the mode of action. You need to talk about 2 side effects and also 1 nursing implication. Apart from aminophylline, you can also talk about giving salbutamol. So you can give salbutamol 4 milligrams, or you can give 2 milligrams 3 times a day. But if you give 4 milligrams, you just give it as a single dose. Apart from that, you can also now give an anti-inflammatory drug such as prednisolone. And in terms of prednisolone, this is a corticosteroid which will help reduce inflammation. You can give 25 milligrams as a single dose, or you can even as well give hydrocortisone 100 milligrams as a single dose. But all these drugs ensure that you give their mode of action, dosage route, side effects, as well as a nursing implication for you to be able to get 5 marks for each particular drug. In terms of nursing management, you need to start with patient resuscitation. And in terms of patient resuscitation, talk about the airway, breathing, and the circulation. And then from there, bring in cardinal headings from a prophenema, starting with the environment. So in terms of the airway, I'll just give brief points, but you can add, because when you look at other lessons, we have been talking about the ABCs more frequently. So in terms of the airway, you can ensure that you remove secretions if there's presence of secretion using using a suctioning machine so as to promote a patent airway. So talk about that point. You can also talk about repositioning the patient, among others, for free flow of secretions. In terms of breathing, you can check for oxygen saturation levels. If below 90%, you can give supplemental oxygen. You can give oxygen 1 to 2 liters per minute to promote tissue perfusion. You can nurse the patient in a well-ventilated environment to promote lung perfusion, and also other points may still apply. In terms of circulation, you can give fluids, and these are going to promote circulation or improve the circulatory system. Then apart from that, you can also talk about giving fluids, examples of fluids that can be given. And you can talk about fluids such as normal saline, dextrose for energy, and if there's electrolyte imbalance as well, you can talk about Ringer's lactate. Apart from that, then you can talk about cardinal headings from a prophenema. So in terms of these cardinal headings from a prophenema, you can, in terms of these cardinal headings from a prophenema, you can talk about the environment. And in terms of the environment, you can talk about nursing the patient within the general medical ward in the acute bay for easy observation. Then apart from that, you can say I'll nest the patient in a quiet environment to promote rest, clean environment near the nurse's bed for easy observation. The room should be well ventilated and free from dust to prevent nosocomial infections. Apart from that, the environment should have all necessary resuscitative equipment for use whenever needed. In terms of position, you can talk about nursing the patient in semi-Fowler's position, and this will promote lung expansion. You can talk about OBS, doing OBS as usual. Talk about TPR and BP for baseline data, and you can observe any cardinal symptom of asthma that can be observed. Talk about psychological care to the patient, and in terms of psychological care to the patient, this also helps create a therapeutic relationship with the patient so that the patient can have confidence. So here you can teach the patient about the condition itself to promote knowledge, involve the patient in the care, to allay anxiety, explain procedures being done. Apart from that, you can also allow the patient to verbalize their fear. This helps allay anxiety. So these are some of the points that you can talk about amongst the others on psychological care, but even involving the relative in the care and explain what is happening to the patient. This will promote cooperation and also allay anxiety. Talk about hygiene, wiping the patient frequently from sweat because they sweat a lot because of shallow respirations or increase the respirations. So you need to wipe the patients frequently, do bed making, hair care, nail care, oral care, changing of sewed linen. Those are some of the points you can talk about on hygiene. Exercises, you should just encourage the patient to be performing diaphragmatic breathing, as this will strengthen the respiratory tract. You can also encourage the patient to be performing relaxation exercises so as to strengthen also the air and promote breathing. You can encourage or explain to the patient not to perform strenuous exercises, but perform just minimal exercises to strengthen the accessory muscles of the chest for breathing. Talk about nutrition, give nutritious meals rich in proteins, vitamins, and minerals, and you can give examples of such foods. And then you can talk about medication, and you say, I'll ensure that the patient is taking all prescribed drugs such as aminophylline, salbutamol, prednisolone, or hydrocortisone, or even paracetamol for fever, because there may be fever because of inflammation. And you can say, I'll explain the importance of giving the patient these drugs, their side effects, as well as the risks involved in not giving the patient the medication. Then as usual, you talk about advice on discharge. In terms of advice on discharge, teach the patient on how to use an oral inhaler and caution him about the possible adverse reaction associated with the medication he or she is receiving. Then you can also show the patient on how to breathe deeply, instruct him on how to cough secretions if they accumulate overnight. Apart from that, you can teach the patient and the family to avoid known allergens and irritants such as smoking, dust, perfumes, fair or cold weather, so as not to experience recurrent asthmatic attacks. You can emphasize the importance of taking only prescribed drugs only prescribed drugs, because certain drugs such as aspirin may precipitate an asthmatic attack. Apart from that, you can explain to the patient about the importance of review dates, teach the patient on the signs and symptoms of impending asthmatic attack, and encourage them to seek medical attention as soon as possible on the nearest healthy facility. You can also talk about encouraging the patient on taking plenty of fluids, at least more than 2 liters of fluids in 24 hours, as this helps loosen secretions and maintain hydration. By doing so, it also prevents the patient in going into recurrent asthmatic attack. Encourage also about nutritious meals, because you need to build the immunity, and this will prevent infections and fatigue, because these can cause a patient to go into an asthmatic attack. So these and many others are some of the advice on discharge you can give a patient. Some of the complications of asthma, we have atelectasis, which is lung collapse due to accumulation of air in the alveoli without expiration or removal of this same air. So you find that the patient may experience atelectasis because the airway is blocked, air can't come out and it is accumulating in the alveoli. There's tension in pneumothorax, which may occur, and this is due to rupture of the subpleural membrane. Apart from that, there's cardiac arrest, which may occur secondary to respiratory failure, emphysema, which is the irreversible accumulation of air in the alveolar spaces due to repeated asthmatic attack, which result in decrease in total breathing capacity. There's respiratory failure, which is, and this is the impairment of lungs' ability to maintain balance between oxygen and carbon dioxide. And this is because of a blocked airway in asthma. Apart from that, status asthmaticus, and this is a severe asthmatic attack which cannot be controlled with usual medication. And this arises when impaired gaseous exchange and heightened airway resistance increase the work of breathing, and symptoms of acute asthmatic attack continues despite having measures to relieve them, such as giving salbutamol, nursing the patient in a well-ventilated environment. These fails to work in status asthmaticus. So these and many other complications may occur, but at least you need to know a minimum of 5 complications. So in today's lesson, this is where we are going to end.